Premier. The doctors and patients here today are victims of your scandals and waste. Billions of dollars have been squandered to benefit Liberal friends and special interests. Because it's more important to this Liberal government to pay millions of bonuses to Pan Am executives than to make sure 800,000 Ontarios get a family doctor. Because it's more important to this Liberal government to dole out millions from eHealth to Liberal-friendly consultants than to make sure addiction clinics don't shut down. Mr. Speaker, how can the Premier tell the doctors that are here today and their patients that paying for her scandals is more important than funding frontline health care?
Thank you. Premier.
The long-term care.
Well, thank you, Mr. Speaker, and I want to welcome the doctors who are here today and acknowledge their presence. And I want to say that I'm proud to be part of their profession. And I also want to say that I was proud to see that I had a meeting with the OMA executive, with the president of the OMA, Dr. Michael Toth, yesterday. We talked about a number of issues. I reiterated the government's interest in negotiating and getting back to negotiating. We've never actually stopped that process, Mr. Speaker. We followed a process that was agreed in writing by the OMA back in 2012 that led to an umpire, to retired Judge Warren Winkler, coming up with a proposal, accepting the government's offer, and imploring the OMA to accept that offer. Regrettably, the OMA didn't. We are implementing the offer that was presented and endorsed by retired Judge Warren Winkler. But we had a very positive discussion yesterday with the OMA, and I'm happy to talk about that in the supplementary.
Thank you. Supplementary.
Mr. Speaker, back to the Premier. Hospitals across Toronto are operating at 115% capacity. Hospital beds are filled with seniors who now wait 69 days to get in a nursing home, an increase of 18 days since
Excuse me. President Treasury Board is warned. Carry on.
Thank you for that, Speaker. Health Quality Ontario reported that half of Ontarians are not able to schedule a timely visit with their primary care provider when they are in need. Yet this government responds by cutting over $800 million to doctor services, forcing clinics to close, and sending more and more people to hospitals' emergency rooms. Mr. Speaker, where are this Liberal Premier's priorities? Will the Premier reverse her health care cuts before the next set of clinics close in this province?
Please. Thank you. Minister of Health.
Mr. Speaker, the examples that the member opposite just gave are precisely the reason why we've asked our physicians.
The member from Leeds Grenville is warned. Carry on.
The comments and the examples made by the member opposite are exactly the reason why we've asked our physicians, after a 60% increase over the last decade, to the point where they're the best-paid doctors, as they deserve to be, Mr. Speaker, the best-paid doctors in this country. We've asked them to hold the line, take a modest reduction so we can actually invest in home and community care, and so we can invest in our hospitals, so we can invest in the other health care workers who are at the front line working hard, like our PSWs. But, Mr. Speaker, when we met with the OMA, when I met with the president of the OMA yesterday, we had a very good discussion. I presented to them another opportunity to create, as Warren Winkler, the conciliator, asked us to do, a task force to look at the future of physician services. He embraced that and endorsed that, and the OMA previously did as well.
Thank you. Final supplementary.
Mr. Speaker, the Health Minister is asking doctors to take a pay cut to pay for their scandals, the gas plans, e-health, and smart meters. Mr. Speaker, back to the Premier. The Health Quality Report found that less than half of patients hospitalized for heart failure or chronic lung disease see a doctor within the week after discharge. For those hospitalized with mental illness or addiction, the numbers are even worse, with more than two-thirds of those patients failing to see a doctor within 7 days of their release. Which is why, Mr. Speaker, the Liberal government's cut to physician services makes no sense at all. The cost of these cuts will not be measured in stats or dollars and cents. The costs will be measured in the suffering the seniors will endure when they wait hours for ER because they can't get an appointment with their doctor if they're lucky to have one at all. Mr. Speaker, does the Premier not care nothing for the suffering that these cuts will inflict on the people of this province who deserve timely, quality health care?
Be seated, please. Be seated, please. Thank you. Minister.
Mr. Speaker, first of all, we aren't cutting the budget for our doctors. Our doctors' budget is increasing by 1.25% this year. It's increasing by 1.25% next year as well. We're bringing in 700 net new doctors into this province this year alone. That's 3 times the rate of population growth. We're continuing to provide the services that people depend on. We're not talking about health services and the delivery of health services. We're talking about one thing, Mr. Speaker. We're talking about compensation to our doctors, who are the best paid in the country, as they deserve to be, Mr. Speaker. But I want to get back to that important discussion I had with President Toth of the OMA yesterday, where we provided them with the opportunity to work in partnership with us to create a task force on the future of physician services, to look at a whole broad range of issues, including compensation, Mr. Speaker. We're prepared to negotiate today, tomorrow, going forward, working in partnership with the OMA.
Thank you. New question. The Leader of the Third Party.